Otherwise on SAFM.
Otherwise, it is moving on. We're going to start with a woman who I suspect we could well be calling a woman making waves in Africa. She is Miss Penina Ochola Odhiambo. She's the country director of AMREF, which is the African Medical and Research Foundation. And they are just about to launch, or coming up very soon, they're going to be launching a campaign called Stand Up for the African Mothers campaign. Well, we have her in our Johannesburg studio. Hi there.
Hi.
May I call you Penina?
Yes, call me Penina.
Lovely to have you with us. Thank you very much. Tell us, I think before we get on to the campaign, tell us a little bit about the African Medical and Research Foundation. It sounds like you do a great number of different things.
Yes, African Medical Research Foundation was founded in 1957. It's about 55 years. It's headquartered in Nairobi. It's the largest African eye NGO located in Africa, supported by African employees addressing issues of African health. Here in South Africa, we have worked for 17 years, but we have programs in other countries of Africa. 7 programs in country offices of Africa and 30 programs on consultancy basis in the continent of Africa. We really are involved in public health, and I think over time since it was founded, the time it was founded, it was called the Flying Doctors Services. The concern for the founders at that time was reaching the unreachable, those remote, vulnerable people who couldn't access health in any way. So they took health services and specialists to the remote area using an aeroplane. And after that, the organization has evolved to become a recognized public health institution, serving a lot of people, still taking the same idea of reaching the unreachable to the remote corners of Africa. I think in brief that's what AMREF is about.
Oh, it may be briefly described, but it sounds like an enormous job. You're listening to Otherwise here on SFM. We're talking to Penina Ochola Odhiambo, Country Director of AMREF, the African Medical and Research Foundation. And here on SFM, you're listening to Otherwise, talking women, and we're talking about women on a major scale. We're talking to Penina Ochola Odhiambo. She's Country Director of AMREF, the African Medical and Research Foundation, who do an enormous amount of work right across the continent, reaching the unreachables. Penina, if I may call you that, I'm just thinking that the unreachables very often will be women. To what extent do your eyesight turn towards women's issues?
Yes, the priority, you're right, the most vulnerable, the poor, the composition in a population will be women and children. Our priority number 1 is mothers and children in any setting. Other programs include HIV and the rest. But we are concerned that mothers in the continent of Africa are still dying giving birth. That's a concern that AMREF has, and I'm sure other organizations are concerned the same way. There's no reason why the continent should be recording very high maternal mortality rates in this day and age. So yes, the focus for us is mothers and children in Africa, looking at pregnancy and making pregnancy safe, because most of the women die at that period of pregnancy, child delivery, and after delivery.
Yes, indeed, which brings us through to the Stand Up for Mothers campaign, Stand Up for African Mothers, in fact. What's the vision there?
The vision here is based on what I've just described. AMREF felt that they should sensitize the public in the world to the plight of women in Africa. So the first campaign was launched in France in 2011. Thereafter, the campaign has gone into our offices in North America, in Europe, in Africa. The real vision behind this is we think if we support the training and skill of the midwives, we will be able to make a little difference so that when a mother goes to see a midwife, she'll receive quality, skilled care that is required to save her life and to save the life of her newborn. So we are hoping, with the resources allowing, we should be able to support governments of Africa to at least train 15,000 midwives. We are also hoping, we have already nominated a midwife for the 2015 Nobel Prize. Her name is Esther Madudu from Uganda. We just want to bring the midwives on the table as an area that if we trained them, at least we shouldn't be experiencing so many deaths among pregnant mothers and their newborns particularly. The tool to do that is to put skills in the hands of the midwife.
Why do you think the number is increasing so drastically? Is it increasing the number of maternal deaths as a result of pregnancy or childbirth? Is it increasing simply because our numbers are increasing? Because in the old days, childbirth has very much been left to women, if you know what I mean. It's one of those things that happened within the home. Have we lost the knowledge, or are we just dealing with way more pregnancies than we used to?
I think the population has increased in the world. And as a result, more women, young people are getting pregnant. Those many years ago, you didn't have teenage pregnancy. You didn't have a lot of abortions taking place. Because of the bigger number of young girls and boys, we have to deal with adolescent sexual health to begin with. Those days, it was perhaps not a big issue. Other issues have come to play, HIV and AIDS. Other factor has become people are more than the health facilities that we had those days. Distances are still as great as they were those days. And access to information at the household level is still a big problem, making it difficult for people to make decisions in good time to access health facilities for their pregnancy management, delivery, and postnatal care. So distances in Africa are still great. Secondly, economy doesn't allow for free movement. You want to go to a health facility, but you have to pay for that fare. Many times, perhaps, you don't have that bus fare. But also around your life as a family member, a pregnant woman, there are so many people, the significant others who do make decisions about whether you should go to the clinic or not, and particularly the male partners. I think we were not worried so much those days about male involvement. But now we are getting more and more concerned about male involvement in the health of the woman who is pregnant, to support her to be able to access services in good time so that we avoid these unnecessary deaths.
One of the problems that we have here in South Africa, that we have many teenage pregnancies. I'm not sure what the statistic is, but I know that a good number of the babies born are born to very young mothers.
Yes.
Is family planning part of the Stand Up for Mothers campaign as well?
Yes. When we talk about Stand Up for African Mothers, it's not just delivery. It's not just looking after the newborn, but it's how can we also make sure that we help those young people to prevent pregnancy. At least teach them about life skills, how they can protect themselves, how they can delay their sexual debut, and so many other packages that go into life skills. We have programs, for example, in this country where we call it WizKid. And in the WizKid is using football to send the message that yes, you can control. If you can control a ball, you can also control their life. So we need to find mechanisms and different ways, tools of accessing communication with young people, at least to make them delay. Go to school, get your papers. Sex will come, but let's have it in an organized way.
We're hearing a little bit about the Standing Up for African Mothers campaign that's been put together by the African Medicinal and Research Foundation. Do stay with us. Well, here on Otherwise Talking Women, we're talking about the Stand Up for African Mothers campaign. We're talking to Ms. Penina Ochola Odhiambo. She's Country Director for AMREF, the African Medicinal and Research Foundation. Just would like to come back, if I may, to the issue of training up midwives. And you said that you're working to support governments across Africa. Are you working directly with their departments, their health departments? And are you finding that they are receptive to your suggestions?
Yes, the most important partner that we have, actually to begin with, AMREF has selected some 10 countries to begin the process. But all in all, AMREF is a key partner to the national departments of health across Africa. There's nothing we do without that collaboration, because we have to align our strategic plans with those of the national governments of the countries where we work. So there's cooperation there. For example, here in South Africa, we have MOUs with the provincial, the provincial levels of the government. And so that makes us be able to access those unreachable people with programs that we bring on board. So we want to hope that when we do raise funds like we are about to, I'm about to talk about, to do some work in South Africa on the same, we definitely will have overwhelming support with the government. We are currently targeting Vembe district, and the district management, the provincial district, has already embraced the idea and very happy about it. And that's why on the 11th of September, we are doing an official launch. Mama Gracia Machel, who is a renowned and respected woman leader and an advocate for women and children, is actually AMREF's champion in this campaign. And on the 11th of September, we do hope, and she has confirmed, that she'll grace the occasion, because she'll not only talk to this country, but she'll be talking to many countries of Africa, at least to make, because we can do it ourselves. If we depend too much on external support in terms of resources, we might not make the number. 2015, which is the target for MDG for mothers and children, is coming very soon. And we can't keep looking outside for external resources, and that's why AMREF is working so hard to mobilize resources from within, so that we can build on what the governments of these countries already have in terms of strategies to bring down maternal mortality and child mortality.
Yes, indeed. In fact, the MDG, was I was just going to get to that, the Millennium Development Goals, particularly in regard to preventing maternal mortality. Do you think that we are getting there?
No. I mean, most countries are looking good in terms of child mortality, but maternal mortality is at a slow pace. I've just come from Mozambique. They have admitted that really to get to that by 2015, 2 years from now, is a tall order. Most countries know that that's a tall order, because we have to set up strategies for community-based programming that reaches that woman who is struggling to deliver in the village. That woman is yet to be found. And as long as we are not having adequate strategies to reach that pregnant woman and bring a skilled birth attendant closer to her doorstep, I think this particular indicator is a tall order for most African countries.
It is indeed, but it certainly sounds like AMREF are doing their very best to reverse that. Ms. Penina Ochola Odhiambo, thank you so much for joining us, and very best of luck with the campaign.
Thank you so much.
Thank you. It's been my pleasure. Ms. Penina Ochola Odhiambo is she's with AMREF, the African Medical and Research Foundation. Well, if you'd like to find out more about the Stand Up for African Mothers campaign, it's going to be launched on the 11th of September. Do check their website. It's www.amref.org. That's AMREF.org.